This episode of Simulation Nation is brought to you by Avkin, your one-stop shop for everything standardized patient and wearable simulator.
Hello, everybody, and welcome to Simulation Nation. Today, we are going to be talking about imposter syndrome and kind of going through some of the self-doubt that happens and just kind of being able to work through some tools and options to kind of overcome that.
Yeah, I would say, from my own personal life, I can speak very highly of this. Definitely coming from a point of personal experience. So I think the other thing to make sure that we talk about is that the imposter syndrome is kind of like the old term, but it's also called imposter phenomenon. And that's because syndrome is typically associated with a diagnosis, and this isn't really a diagnosis. But I think the reason that syndrome comes about is that it typically, in my mind, a phenomenon is something that happens once or every once in a while, where I think a syndrome is something where it's kind of repeated and it happens over and over again. And I think in my mind, that's probably why it got its first name, but it is more appropriately termed phenomenon, though people, I think, identify with the term imposter syndrome.
Yeah, I think it's maybe a little more, at least in my mind, I didn't know that had changed. So I think that imposter syndrome is still kind of like the common way of referring to it, even though it may not be the most appropriate way of referring to it.
Yeah.
So just to start off with the definition, just to make sure that I think we're all on the same page, because I do think everyone has a little bit of their own definition, and typically you're not looking it up. But the actual definition from Oxford is the persistent inability to believe that one's success is deserved or has been legitimately achieved as a result of one's own efforts or skills.
Yeah.
And I looked up some statistics, and about 70% of healthcare workers at some point in their career have felt that imposter phenomenon.
Yeah, I definitely think early career is typically a highlight for where you might be feeling that.
Yeah. And I think that's one thing that really comes up when you are looking at nursing students. And I think it's funny because I had the very unique experience of doing the standardized patient work. And when I started working through the program, I was younger than everybody when we started. And then over time, I became older than everybody, and they stayed the same age because they were college students. So it was like they stayed the same. So then it was like I was moving on and getting married and having kids, and it was super weird to be like, I remember that when I was younger than the students that were taking the course.
Yeah.
But being in that very unique situation, you see students, and it's really like, they are about to go out and graduate and then have the ability to do these skills and be responsible for human life. And I do think that is a very heavy pressure, that we want people to have that pressure of understanding their responsibilities. But I think that imposter phenomenon can come up because of that heightened responsibility for such a young age.
Well, I mean, it's transitioning from one persona to another. I can remember very often, I couldn't wait to graduate from nursing school, not necessarily because I felt as though I was super ready or anything, but because I was ready to start making money.
Yeah.
Honestly. And I have that tendency that drive to keep pushing forward. But I remember even my very first year and being in the skills and simulation area and saying, you guys excited about graduating? And almost predominantly everyone's like, no, not at all. They enjoyed being a student, which is kind of generational, but they also did not, they understood that they were stepping into a new level of responsibility. And I think the really important piece of this, when you're thinking about that and stepping into a new piece of area of responsibility, whether it's, going from a student to a licensed professional, or stepping from a bedside nurse into a nurse manager, or stepping into an academic position, whenever you're leveling up, you're getting to the edges of your comfort zone. And I remember reading a story about this, where if you consider this phenomenon or this syndrome, if you consider that when you get to the edges of your comfort zone, that's where that guard dog is going to start waking up and really start screaming loudly to you. I think that is a really good way of putting it. And I think that it's really an analogy that worked for me to understand that when I'm starting to feel that way, I'm getting to the edges of my comfort zone. And at that point, a lot of people will choose to retract and not go beyond that comfort zone. And that limits them, right?
When I think a lot of that is the anxiety too, because that's really what anxiety is just an alarm system for your body of like, hey, we're not safe right now, something's wrong. And when you do start to get to that uncomfortable position, that anxiety is gonna start alarming you of we're not safe, we're, and I think that in terms of the imposter phenomenon, it is that mindset of I'm going to be found out. They're going to realize I'm a fraud. They're going to realize I'm not qualified for this. They're going to realize that all of this, like that I'm not actually able to do this.
Yeah.
And I think that there is that sense of fear of, well, I don't want people to question me, or I don't want to be, again, found out or something along those lines. Even though, again, we know that most people feel this way and that this is a very common feeling, I think in those moments of anxiety of really stretching yourself, you do feel like, no, I'm the only one going through this. No one else really understands
people don't really talk about it. And I think that again, I have an author that I absolutely love on this topic. She actually calls it the inner critic, which I think is almost even a better term. But she said that until she was vulnerable enough to share that in public it was an all women's meeting, she didn't realize that other people struggled with the same thing that she struggled with. And then all of a sudden, it was as if it was normalized in a way, which doesn't necessarily make it go away, but it does help to understand that you're not the only one that has this, these self-talk issues or these concerns that somehow what you've done is not good enough or what you're planning is not going to be successful. I grapple with it today in running a company. I think that as we move into the next phase of company growth, or as we move into our next product that's being launched, it is that, oh wow, it's a big leap, and I have learned to embrace it, but it is something where people can be held back. I think a lot of in the literature, it talks a lot more about women having this inner critic than men, and it doesn't mean that men don't have it. I don't know. I obviously am not male, but less men have it than normal. And there was a story that was being shared about how three people were studying for the exam. One was a male and two females. And the females spent all weekend studying, didn't go out anywhere, didn't do anything. And the guy studied for a couple of hours each day and then went about his life. And they took the exam. And when they left the exam, they, said, hey, what do you think? How do you think it went? And the two girls were like, I don't know. Like, I didn't know the answer to this question. I didn't know what to do here. And the guy was like, I think I did great. And so it's almost like a mindset of we beat ourselves up, and maybe we spend way too much time trying to, get certain credentials or certain things before we'll step into the next venture, or we'll hold ourselves back because that guard dog is, kind of at the edges of our comfort zone.
Yeah. And I think that a lot of that, though, has to do with, the way that we're brought up. And I think that there are, we're seeing a lot more female role models and things along those lines. But I do think it's when you're brought up and you don't have that person to necessarily identify with or see where that they've done what you want to do or something like that hasn't happened, then it does create that different mindset. But there are a lot to do, in the research. I don't have the exact statistics, but in terms of gender inequality when it comes to imposter phenomenon, as well as race and ethnicity. Those both really play a large piece because, again, I think part of it is not having the same mentors, which is a very clear, I don't want to say antidote, but again, it helps when you have that mentorship for when you're feeling that imposter phenomenon. And when you don't have someone who looks like you or that you necessarily identify with, I think that also plays a huge part in not having that person to be able to say, I struggle with the same things. I've been where you've been. This is the path forward, right? And if they don't see that path forward, or they have to blaze that path themselves, I think those anxiety alarms go off a lot more. And then again, it leads to that feeling of you're walking this path or you're blazing this path alone, right? And I think that leads to a lot more of that questioning if you actually are qualified to be able to do that.
Well, and I think there's also situations where, because you don't have a lot of point of references, or you don't have those models, and maybe you have a few, but they haven't necessarily shared what they struggled with, right? I try to be super vulnerable about this kind of thing, and only 2.7 women who are entrepreneurs get investment funding. And that is a staggering statistic that only 2.7 of female entrepreneurs end up getting investment funding. And what happens, I didn't have a lot of role models of women that actually had gotten a company up and going and gotten the investment funding.
Especially without the background of having a business degree or something along those lines. Right,
sure.
Yeah.
Well, yeah, we can talk about that all day too.
Yeah.
But in talking to my investor, he would say very often when we were having maybe a little heated discussions, maybe, a disagreement here or there, and he would remind me that not very many female entrepreneurs get backed. And I finally said to him, that is a microaggression. When you say that, what I hear is, you better listen to what I'm telling you to do because nobody else is going to invest in your company. And I had to not just silence the inner voices, I also had to silence the outer voices. And that hasn't happened since.
Well, and I think that it is sometimes when you do have that inner critic or you do have that, you are going to take different comments in a different light, right? Again, it's something that when you have that own self-doubt and then you hear something that might solidify that doubt or again, maybe encourage that doubt, it is speaking out against that. And something that you said just in terms of people being vulnerable, the great Brene Brown, who, again, absolutely amazing when it comes to this topic, but she talks about shame. And I think that there is a lot of pieces of that kind of go along with this, is there's this element of, I'm not good enough, I'm not going to be able to, meet this or goal or whatever that is. But what she talks about is that shame can't survive when it's spoken. So when you're able to speak these things out and address them head on, that there is this element of them reducing. And in my own professional world, again, I didn't come from a marketing background. I didn't come from a healthcare background. And those are two things that I do day in and day out. And there was this element of, I'm not the right person. I'm not, and there were people saying,
I remember you saying that.
And then again, I remember feeling it because there is those anxiety alarms of saying like, there has to be somebody else. For me personally, it was when we brought in other people and I realized, oh no, I understand this a lot more than they understand this from a concept of the company and things along those lines and what's needed for the customer and all of these elements. But it did take time to almost prove to myself that there wasn't someone else more qualified. And when I was able to kind of work through that, it did help me be more vocal with my own experiences of feeling that element of, that imposter phenomenon. And the other thing that I've really liked is being able to have a lot of people come through and how vulnerable you are in the element of being able to talk about it, and that empowers other people to be able to share that same experience. And I think that at the end of the day, the more we can just say, everyone's figuring it out and nobody feels like they've arrived, and I think we see that consistently, the more that it empowers other people to be able to verbalize it. And I think that when people are able to verbalize it, like I said, it really takes that power away the second you're able to kind of speak it out. And then all of a sudden it just becomes,
And I think that's the purpose of a lot of the nurse residency programs is to allow those cohorts to feel united in that they're all going through the same thing at once. They're all experiencing some levels of uncertainty, and they're growing into those clown shoes, as I always talk about, right? It's just trying on those clown shoes for the first time, and every day the clown shoes get a little bit smaller, and at some point you don't realize it, but then they just become regular nursing shoes or healthcare provider shoes, whatever the case may be. But it is a matter of being willing to try them on, and it is a matter of being vulnerable enough to say, I'm not sure what to do here, or what to say in this situation, because that's the way you're going to learn,
But I think that's also the same culture we want to create with inside simulation as well, though, because I think that that's the other piece of this is, as long as it is, if you are creating a psychologically safe simulation learning experience, there should be the ability to say, I don't know what to do next, or I wasn't sure what to do here, and being able to address that. And I think that then that culture of vulnerability with being met with someone who's receptive, who can share that, and again, it's not judgmental, then leads to a nurse residency program where people can, again, share freely and feel like they're not going to be reprimanded. But I think that's why it's this concept of psychological safety that, we've already discussed, we know it's so important, but being able to continue that method is what's going to create a healthy environment later on for these students going through that. But that's why a toxic simulation environment can cause so much problems down the line, because if that student gets met with judgment or frustration or, well, you should know this and things along those lines, that then leads to them not feeling they can be vulnerable in group settings and things like that down the line. And I think it can severely impact their experiences, long term going into that.
Yeah. I mean, if you think about it, simulation stretches you to the edges of your comfort zone, right? So that it does bring out some of that imposter phenomenon or inner critic, as I would call it. So it's right there. And then they get the opportunity to talk about it afterwards. And so if it is a safe environment, and if it is a caring, psychologically safe debriefing, they do get into that culture of being able to share where they were struggling or what they were unsure of. The other really cool thing about simulation, and I didn't think about it till you were just talking about it, is they do typically work in groups, right? So 4 students may be taking care of one patient, and it really is, they're fulfilling all of the tasks of the nurse. Again, just for points of time. But when they can go over to someone else and say, hey, can you help me with finding the blah, 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 or, I'm not sure what to do with this blood pressure. Can you check it for me? When they get into that mode within simulation, that also helps build that collegiality or that teamwork. Again, interprofessional sim is so amazing when to build that even more. But even the idea of having to have more than one student, sometimes I would always apologize for them having to be more than one student in there. But I think it does help to build that culture of teamwork and reaching out to other people and asking questions. Kind of the lifeline concept or idea. So,
well, I remember very distinctly, this is funny because it's like one of those memories in the very far back of my head, but I do remember having students come into one of the simulations where they had to set up a PVC pump, or
PCA pump.
PCA pump, not PVC. PCA pump.
Right.
And they had to set that up. And I do remember one nursing student being like, they were doing their kind of like prep beforehand of kind of like getting ready for it. And one student was like, I feel really confident with that. You draw up the meds. And she was like, okay, I'll draw up the meds, but can I come watch you set it up because I'm not as comfortable with it? And she was like, yeah, absolutely. Like, I'll walk you through it. And I remember in the sim, them walking the other student through, like, okay, and then you got to make sure if it starts dinging here, you got to push this. But it was like, again, there was just different people had different strong suits, and being able to watch someone who had confidence with being able to do it, again, it's
which
really
is amazing
cool
in an undergraduate program.
Right? That's what you want to see. And I think that collaborative effort, those are the kind of memories, or those are the kind of footholds that are going to lead to, help later on. And again, like you said, having that lifeline, having that person, I think that really is a strong foundation for people to feel confident to be able to reach out, to be able to talk about, those feelings and those emotions that they have.
Yeah. And I think that one thing that I read about this, again, mine goes back to the book, Tara Mohr, M-O-H-R. It's called Playing Big, but this is the first time I read on it, and she has amazing stuff on the internet. You can read her blog posts. But one of the things that she says is, you said kind of like call it out, right? But she said you can't argue with it. Arguing with it and fighting back doesn't necessarily change anything, right? Again, I always think of it kind of as a guard dog at the edges, but understanding why that guard dog is unsure. Why is that guard dog alerting you? And truly saying, thanks for letting me know that I'm at the edges of my comfort zone. I appreciate that, but we're going to move forward because I have confidence in where we're going. And I think that talking to it as if it's an actual being, and acknowledging why they may be fearful. A lot of times they say, it kind of comes from something potentially in your childhood, but just, I'm an adult now. I've got this. I know I can do it, and I'm going to learn. I think that will keep that imposter phenomenon or that inner critic, quieted to some degree. So moving forward out of your comfort zone into the next level of leadership, or, stepping out into a new horizon feels more comfortable. And again, the idea of having mentors, the idea of looking to people who've been there, the idea of having people who are going to be honest and open about how they felt as they were stepping into that new leadership position is so important and helpful. And then also, how are you addressing that inner voice that is common in so many people?
How did you address it in the academic sense? So again, when you were starting in simulation, I think a lot of people, we have to go forward and kind of fight for simulation, fight for, the standards, what the needs are and things like that. How did you approach that from the mindset of maybe not coming from the most confident place?
Well, at the time there was no name imposter phenomenon, or there was no, like, the people weren't openly talking about it. So I would have to say my own personal experience was I came right out of a clinical setting. So I was confident with the skills and the assessment knowledge that they needed. And I was, I would always say, if they come in with basic knowledge, I can send them out with, advanced beginner knowledge. And then if they come out with, if they come in with advanced beginner, then I can send them out with intermediate, So I understood kind of how to help them get to that next place. Where I really struggled is if there was technical problems. I did not feel confident with the technical problems. I probably shouldn't say this on air, but I at one point kidnapped our technical support team and told them they weren't allowed to go to lunch because we were on a call. And it was you
said, I'll go get lunch.
I'll go get lunch here. I did make them cookies the next day. But I didn't feel confident with any of the technical aspects. And when I would call into tech support, whether it was the AV system or it was one of the mannequins, they would ask questions and it was like they were speaking Greek to me.
Yeah.
It felt very overwhelming. So that's where I felt a lot of imposter phenomenon of like, how do I feel as though I am, able to do that? Now, when I started to get into my master's degree, because at the time I had my BSN, and if you have your BSN and you're in an academic setting, sometimes there's some differences. But as I was starting to get my master's degree, there was a lot of times where I felt as though I wasn't smart enough for that. I really struggled with that aspect, or that self-talk, as I was going through my master's degree, especially because I was getting it at the institution where I was, and not every instructor was kind. I mean, I had plenty of wonderful instructors who only wanted the best for me, but you could almost tell in some of the feedback that you would get about your papers or whatever you had submitted. And so that was definitely an imposter phenomenon, because I didn't do well in school. I was a BC student in nursing school. And, I had to take a couple master's classes to prove that I could get good grades before they'd matriculate. It's called matriculate, before they matriculate me in. So, I ended up thriving as an adult going back. It was just that I knew a lot more about myself and my study habits. And it wasn't rote memorization like it was in nursing school. But I did struggle with the confidence that I would be smart enough to go through an advanced practice degree.
That makes sense. And I think that a lot of times, though, it's still that element of working through it. You're not really identifying that you are now a leader, right? I think that that's the other piece of this, is not being able to identify that you are moving into a new role. And I think that goes back to the psychological safety component, is if you're not addressing that you're now leading, you're not as careful with your words. You're not aware of the impact of your words. But I think that that's another piece that gets missed often inside of hospitals or inside of academic institutions. But that element that you now moving into this position is a leadership position, and your words matter and carry a lot of weight.
Yeah, I mean, I think that it's kind of even almost a different topic, but the idea that it should almost be a rite of passage, like how the Native Americans had a rite of passage when a boy became a man, or even the Jewish culture has, this like transition party period. I feel as though when you are stepping into a leadership position, whether it is within the hospital setting or within an academic/simulation setting, it would be really smart to almost have a rite of passage to help people grow into that leadership position. There's a lot of adjunct faculty out there in nursing, and I don't think that they understand they are stepping into a leadership position when they take on that adjunct role, that they're molding the next generation of nurses. And so their words matter. We were at the Sim Summit for New England the other day, and I shared the story about how I made an error. I was being lazy, and I didn't put the side rail all the way up on the crib for a pediatric patient I was taking care of. I put it halfway up, but I didn't put all the way up. And in my very underdeveloped frontal lobe, my thought was that the child had gotten club foot surgery and was immobile. And so if I just put it up halfway, there's no way that he's going to stand up and get over the top. But irregardless, the policy was that you lifted that side rail. So my instructor saw that I didn't put the side rail all the way up, and I just gone to the sink to get a basin of water. I didn't leave the room that way. But in the post meeting after clinical that day, he knocked on my head and asked if anybody was in there. That doesn't help. That's one of those outside critics. Right? But it does, it led to a lot of negative consequences for me, even into my adulthood. I mean, I didn't share that for years with anybody.
And I think that that's where that shame spiral can come from, right? One of the people that I listen to that I really like, Dr. John Deloney, he discusses being able to take those thoughts, so that emotion that comes from that experience, and then writing it down, so getting it out, and then demanding evidence of that thought. So again, thinking something like, I'm an incompetent nurse, right? Writing that down, getting it outside, and then being able to look at that objectively and say, is that an accurate statement? Like basically demanding evidence from that statement to say, is that accurate? And that was something that really helped me moving into leadership, and again, managing teams and things along those lines, was feeling not adequate to be able to move forward with that, but then being able to actually say, I'm not just going to allow these thoughts to continue to spiral, because I think that's where we, get lost in things, but being able to get it outside and then demanding evidence of, those thoughts and feelings. And then again, being able to stop yourself from continuing that pattern, because you're able to say, no, it doesn't have evidence. Doesn't hold water.
Right. But I think it's, if you could do that to yourself, that's fantastic. But I think even having someone else that you trust and respect, to have you voice those, like, let's do the same thing. What's the evidence of this, right? Very commonly, even now after many years of having the company, there's times where that happens, and I'll talk to either my husband, or I'll talk to you, or I'll talk to one of the other leadership, and the question is always, where's the evidence for that? It's not exactly said that way, but you know what I'm saying. It's like, what's happening that is causing you to feel this way? And you obviously don't share that with the entire company, because that that can have people feel unsafe in the company. But I think that the point of it being is that you do want that very close, vulnerable group of people that you can be with. One of the other big things for me is I was a part of the 2015 National League for Nursing Simulation Fellowship. And I call them my stiletto network. And that's another book that I read along the way. I read a lot of books. But the idea that you have people that are professionals and kind of within your area of influence as far as where they're going, that you can be vulnerable with, and you can tell them anything, and that they're going to be honest with you about their answer or their perspective on something, whatever it is. And I think having that close group of people where, with starting the company, it was like, I have 19 other women that are cheering me on, and think that what we're doing is amazing in this area, that it solidifies, so I think having people you can talk to about it is so important.
And I think you're really lucky to have those 19 people, but I think even going through it and getting a core group, even 3 or 4, I think is, again, still very helpful, just to be able to discuss those things and being able to just share it, be vulnerable, and then have that empathy that it's met with, where people are then able to talk to you and, again, speak those words of wisdom. And I just think, again, being able to address the fact that this usually does come from, women, as well as people who have diverse backgrounds, either racially or ethnically. Those are things that, again, getting with like-minded people, getting with people who have gone through similar experiences, I think also really helps with being able to work through it and come up with techniques that are going to work for you.
I think one other thing, and I don't know if this is really associated with this whole idea of imposter phenomena, but is the somatic symptoms, the physical symptoms that you get when, like those anxiety symptoms, right? It kicks in when you allow that self-talk to keep going, or you don't really have coping mechanisms or ways to handle it. And one of the very interesting things that I read was that in Hebrew, there's 2 different words for fear. One is pachad, and pachad is basically that guard dog at the edges of your comfort zone. So the way that it was described to me is like, if you're walking in a dark alley at night and someone's following you, that feeling of like, I'm not safe, right? So it's the same kind of idea. But then there's another idea or another name for kind of stepping into something new. So I think of that as you're stepping into a new leadership position or you're stepping into a new position. That yara has the same physical symptoms.
That's the word. So the two words are...
Oh, sorry. Yes. Pachad and yara. So the pachad is the scary, person in the back alley or stretching you to the edges of your comfort zone. But yara is stepping into something new. And the idea of yara is it gives you the same physical symptoms, but it is not, that, I am in an unsafe situation, right? So I think that that's really, from my perspective, understanding that there's times where I'm physically going to feel that butterflies in my stomach, my heart beating a little fast. It's not necessarily always meaning something bad is going to happen. What it means is I might be stepping into something new and unknown. And the way that Tara Moore describes it is stepping into something bigger than yourself, which I think is so cool, right? Yeah. I mean, when you think about where we are right now, as far as the company goes, where we started with just a few of us in a little 1-bedroom apartment above another commercial space, and now we're at 40 employees and, going strong. That to me really speaks to that stepping into something bigger than yourself or something that you ever imagined, right?
Yeah, absolutely. And I think that we've talked a lot about the feelings of, the imposter phenomenon or, that anxiety that can come with it. The other element that I kind of want to take here is we've talked a lot about ways of dealing with our own selves, but I also want to talk about the words that we speak over other people. And I think that that's a really important part that, our whole thing here on our sign is simulationists support other simulationists. And I think that having the mindset of how heavy our words can weigh on other people and being mindful of that. I remember being fairly young in simulation, and I remember feeling a lot of pride in my ability to do moulage. I remember that was something that I really enjoyed doing, got a lot of compliments on. And I remember, and I still very much can pinpoint this moment of me talking about potentially doing that at a presentation, and someone's response being, well, there's people who are really good at moulage, and I don't know if that's something you want to test out.
That wasn't me.
No, it definitely wasn't. I don't know if that's something you want your work compared. And I remember that was a very pivotal moment of it was kind of that inner, it was almost like now that went into my head of okay, anytime I put anything out, that moment still sticks out of okay, your work's going to get compared, and I think that sometimes it is just being very mindful of how we're speaking to others, how we're putting positivity out there, and being mindful that those little comments, those little things that I'm sure that person never thinks of that comment ever again, but how impactful those words can be, not only to students going through simulation, but also to colleagues and also to other people in that professional world, of us only ever going at it from a very positive perspective. And I think that, again, there's realities and all of those components, but we want to be speaking life the same way that we would want that, right? The same concept of everyone's going through that self-doubt, and we want to be able to speak that out in positivity.
Yeah, I mean, again, I think that we are our own worst critics.
Yeah.
And, you put on an outfit for the day, and you're going to inspect that thing top to bottom, bottom to top, and, you may not necessarily feel great about yourself, but you might get 10 compliments that day from other people under the microscope. In other words, when I'm looking at someone else, I'm not putting them under the microscope the way that I do myself. So whenever you can speak positivity into someone, and that's something that I've tried to be super intentional about, just I love your hair, or I love your shirt, or whatever it is, or, again, with students, being super positive with them. I can remember many times just saying, let's just pause here. I want you to think about where you were when you started doing simulations in your sophomore year and where you are now. Just pause and think about your growth, because there is so much growth that happens. And I don't think that other people point that out as much, because we just don't look at the fine microscope pieces. But when you can speak positivity, or when you can put that positive light on things, it means so much.
I think the other piece too is also be able to identify what people are uniquely very good at. And I think that's another thing that...
Superpower.
you are able to see it so much easier from an outside perspective of, oh, you are very good, you are very organized, or you are very good at looking at this from an analytical perspective, or you are very creative, so all of those different components. I think it's also really important to highlight those in other people, again, using our words in that powerful way of being able to highlight the things that people are very good at, because I think that we don't see it in ourselves enough. I think that, again, our talents or our abilities, they kind of blend in. We don't think they're special, and you're able to easily overlook it. But I think the more we can be intentional with identifying things that people are uniquely good at and their unique strong sets, I think that really does help people going forward of knowing what those are.
Yeah, I can remember taking a clinical group into the hospital in the summer times when I wasn't doing simulation. And I remember, we had I had 8 students, and I could almost see where they would work best, what units they would work best on, you know? And I tried to, I told them, like, obviously this isn't, you don't have to take this position, but the idea or the concept of, like, have you thought about being an OR nurse? Or have you thought about working in the ER? Whatever it was, just based off of where they were and how they, what their personality was, what their strong suits were. I also had a chance to know these individuals because I had them in simulation, but so it was a little bit more than just a semester, but you do kind of get to see where people's superpowers are. And that's something that we've tried to take into this company as well. I remember even when you were young, you struggled with certain things, and I'm like, don't worry about that. You can get past that with a computer or something
spelling.
Like that. Yeah, like, spelling was one of them. But, they have computers nowadays. That's not, but I think the concept or the idea of identifying that in other people, because it is hard to identify in yourself, or you don't know if you're better at it than somebody else is, that's a really good concept or idea, especially for educators that are listening in, because I think the more you can point that out, the better, the more prepared the students are going to be to fit into their niche within their professional roles.
Yeah. And going back to what you talked about earlier in the episode, I think the other part that is important as you're growing, again, when we are the one-woman show in the simulation lab, this isn't always possible, but hire for the things that you're not good at, right? For you, with the technical skills, you found Amy Buca, who ended up being your sim tech, and that's her comfort zone, right? That is what she is strong in. She wouldn't be an educator. She didn't want to run sim. She's like, no, I'm very happy with the technical piece. But look at it in terms of, you don't have to be everything to everybody. You don't have to be good at everything. You can hire out for the things that you aren't. Find your complement, find the people who are going to help you with the things that aren't your necessary strong suit. And that's not a knock on you. You don't have to go into that conversation, feeling like insecure about it. Go into it with confidence, saying, this is taking me double the amount of time. Yeah. I shouldn't be spending my time doing this. Let's find someone else who's better at it. And being able to, again, not take that as a threat, or not taking that as someone, again, taking over part of your jobs. No, you encourage that. You say, no, please come help me. This is not where my strong suit is. I'd love for you to be able to come in and help me in this situation. Really does help. And I think that helps people get further in their careers faster, with being able to identify the things that you're not strong in and where someone else is. And then, again, being able to celebrate that as a team, working through that. I think that all is, leads you.
And it creates a mutual respect, right? Because it's kind of like you have your lanes. Yeah. And there's times where your lanes might cross, but when it came to technical issues, I knew who I was going to, that was after we had kidnapped the technical support person for the college. But, that did help get me Amy Buca, which again led to the next thing and the next thing. I think that's a really wise, piece of advice. I was not an organized person. I'm an ER nurse. For those of you out there, that we're not hyper organized people. And so having an administrator would have been great too, know.
I'll never forget, again, working with you so long in the sim lab, but I do distinctly remember someone coming up at the Anaxel booth, and she was like, I'm an ER nurse and I'm new to sim. And you were like, oh yeah, that's my background as well. And I remember she said to you, she's like, does it ever get better? Do you ever be able to think about things more than 10 minutes ahead of when they're supposed to happen? And I just remember being like, whoa, this is really trippy. Like, this is exactly like, you guys are two peas in a pod. Like, this really is that ER background. Yeah. But it is that ability to say, this isn't my strong suit. I can tell you what my strong suits are because I've got tons from coming from the ER. But here's the things that I'm not good at. I'm not good at thinking, super far ahead. Let me find a complement that can assist. And I think that we see that in the world of simulation, right? Where we are starting to see these, sim ops as well as then, CHSE-As and things like that. And oftentimes people who are simulation educators, their strong suit are not going to be in operations. So let's hire someone who can complement that. Let's find the person who is, the yin to the yang that's able to, again, move us further faster.
Yeah. And again, if you're one room simulation
Chef,
center,
cook and bottle washer,
it will get better and you will grow.
Yeah.
The when you start to really collect evaluations and see the impact of that long term, you really can get some buy-in from your leadership to grow that program farther, faster. It's not fast. It took us 10 years to get to where we were getting some help in there, but it is possible.
Yeah. All right. So closing out, I want to ask for you what would be the advice that you would give yourself starting out in sim, going back to like 2006, looking at it based off of what you know now, what would your advice be?
Wow. So she didn't warn me ahead of time for this question.
No, it's on the
so
fly.
I actually wrote a blog post, advice to a younger me. And I think one of the big things from my perspective is that simulation is going to become a research-based, evidence-based methodology and respected in a broader community. And that by embracing this now, you get to kind of ride the wave with everybody else. So I think that probably would be my piece of advice, because at the time you're fighting, faculty buy-in. Sometimes the students, I had to change the culture of the students because they had been a bit traumatized prior to me. So just knowing that things are going to get farther along and you're going to be able to be a part of that probably would have been a piece of advice that I would have given to myself.
Yeah. So I have two that I can think of, but my main one was I remember going to sign up to do my CHSE, and I remember feeling so overwhelmed. Like just this was not
That's
me.
normal.
This is not what I should be doing. Like this is for the other people. These are for other people who know more.
I think as a grown adult who is a professional, going back to take a written exam is very nerve-wracking, especially when it's proctored and things like that. Yeah.
And I remember even because I didn't have the healthcare background, I needed to get special approval to be able to take my exam and everything like that. And I just remember feeling like this isn't for me, or this is just for people who are
into something bigger than yourself. Yeah.
And I remember just having that feeling of like self-doubt and all of those different feelings. And my advice for myself at that time would be, you are still qualified to move forward into this role. You still know all of these components. Pretty much like have faith in yourself, and kind of, again, give myself that little pep talk there of like, you are still qualified to move forward in this world. And there
were other people giving her that pep talk, but
there were, but I think that it's still just that element of seeing that in yourself, that it's like, this isn't just people trying to make you feel better. The other component that I can remember very distinctly early on was not feeling confident with Google Calendar. And we are using this for all of our scheduling for our standardized patients. And I can remember going into it and feeling so overwhelmed that it was just this whole new program that I didn't know anything about. And I distinctly really remember feeling that imposter syndrome in that moment of, I can't do this and I'm going to mess everything up for the whole semester. And I remember in those moments just having so much self-doubt. And in those times, I wish it would have been looking at it as a new challenge and kind of embracing it as like, this is a new skill you're learning. This is a new tool you're putting in your tool belt that you will be able to use later on. And almost looking at it from that point of view of, this is something I'm taking on to put a tool in my tool belt. And I think that if we all looked at new challenges and new things we are taking on, rather from this glass half empty of, I don't know what I'm doing, I'm not qualified to do it, but looking at it as, I'm learning how to do this because I'm learning how to put this tool in my tool belt, I think we would approach things in a much more positive light. When we're teaching a child to ride a bike, we don't get upset when they get on it and fall down, right? The concept is, no, you're learning how to ride the bike. There's empathy, there's understanding that this is a skill being learned. But I think in our adult life, we don't approach things that same way of like, hey, we're going to fall down. We're not going to be perfect the first few times, and that's okay because we're learning it. But if we can approach it from that angle, I think that that's really helpful in our professional development as we go forward, is that we're looking at it with that same empathy that you would look at a child learning something new.
Well, it's all self-talk at the end, right?
Yeah.
It's all self-talk, and it's all, perspective and approach. And, there's just so much literature out there about how our mental health is affected or impacted by the things that we take into our body, but also what we're thinking and how we're processing things.
And burnout is another big one, which we know is so huge in the healthcare world right now, that the more that's getting fed and things like that, it doesn't help with that. But I hope that these tips and tricks and the different things that we talked about were helpful. Again, if this is something that you personally experience, we'd love to hear more about it. Put it in the comments. But I think that any tips or tricks that you have for dealing with this imposter phenomenon, again, we'd love to start that conversation, being able to have it. And we'll talk to you guys next time about more on Simulation Nation.
Thanks, guys.